All right, so we're going to get started. I'd like to just welcome everyone to St. Michael's Academic Family Health Team's webinar, Benefits of Time Spent in Nature in the Context of Climate Change and Health. My name is Anne Rodriguez. I'm a registered nurse at Sumac Creek Health Center, and I'm co-lead of the Family Health Team's Green Team. Today's webinar is the second in a three-part series. If you missed the first webinar, Climate Change in the Context of Health, which provided general information on the relationship between climate change and health, as well as health and medication management in heat waves, you can find the recorded session on the Family Health Team's website, as well as we will provide a link in the chat. So I'd like to begin by introducing the team behind the webinar series, the St. Michael's Family Health Team Green Team. The Green Team started in 2019 by some very knowledgeable, enthusiastic primary care clinicians who wanted to address environmental sustainability and climate change in the healthcare setting. The team consists of 12 interprofessional members and a patient partner. Our primary goals include reducing clinic waste and energy use and educating staff and patients on ways to improve environmental impact through a healthcare lens. Through collaborative events like this one, we hope to increase knowledge about the relationship between climate change and health and inspire action within our communities. Of course, we cannot speak to environmental sustainability and health without acknowledging those who were here on Turtle Island long before colonization. We wish to acknowledge that we are on the territories of many nations, including that of the Anishinaabe, Haudenosaunee Confederacy, the Chippewa, and the Wendat Mississaugas of the Credit First Nation. We acknowledge that this land is covered by Treaty 13, signed with the Mississaugas of the Credit, and later the Williams Treaties of 1923, signed with multiple Mississaugas and Chippewa bands. This area is currently home to many First Nations, Inuit, and Métis peoples. We honor the Indigenous peoples and communities and the work that has been done and is continuing to be done in regards to climate change, the environment, spiritual, mental, physical health. So I'm very pleased to hand it over to our moderator for this evening, Sara Nestaco. She is the clinical nurse specialist and co-lead of the Green Team. Sara?
Thank you, Anne. I'm going to be moderating this session, and I'm going to introduce our panelists, which we're very excited to have with us. We have Dr. Samantha Green, and she is a family physician at the St. Michael's Hospital Family Health Team and the Inner City Health Associates in Toronto. She's a board member with the Canadian Association of Physicians for the Environment and faculty lead in climate change and health at the University of Toronto, Department of Family and Community Medicine. She advocates for climate action with the aim of improving the health of her patients and community, and she's also a very active member of our Green Team. We also have Trina Rosenwig, and she is a parent and child educator at the Gary Hurwitz Center for Community Mental Health at Sick Kids. She works primarily in the St. Jamestown neighborhood, offering support to families and children aged 0 to 6 years of age, and focuses on supporting parents and caregivers and children's development and mental health. And finally, we have Dr. Melissa Lem, and she comes to us all the way from Vancouver, so we're very excited and happy to have her here. She works with rural and northern communities within Canada. She's the director of Parks RX, a national nature prescription program powered by the BC Parks Foundation. She's a longtime advocate for the health benefits of time spent in nature and ecosystem conservation. She's been involved in advocacy and policy work at on a broad range of issues, including climate change and sustainable healthcare. She's also affiliated with the University of British Columbia. And then we have our team behind the scenes. And so Anne Rodriguez, who is an RN with the Sumac Creek Family Health Center and a co-lead of the Green Team, and Dr. Eileen Nicole, who's a family physician with the St. Michael's Academic Family Health Team at Sumac Creek. Next slide. So just a quick disclosure, this webinar series is supported through a grant that was provided by the City of Toronto. And just the information provided here is general health information, but for personalized health guidance, please do talk with your physician or nurse practitioner. So we're going to go through what we'll discuss today on this webinar, and we're basically going to look at first the connection between health and nature, then the importance of nature in early childhood development, and then we're going to review some local resources and programs that helps to get you out in nature, including local initiatives that you can take part in the city. So highlighting some questions that we'll address. And so we're really grateful for everyone who submitted a question when you registered. Some of these questions came up frequently, and so we're going to address them in the presentation. And those include the health benefits of spending time in nature, both physically and mentally. How can we preserve and ensure we have more green spaces, local programs, and how to access nature in the city. So just a few quick housekeeping, how to participate. So at the bottom of your screen, you'll see a Q&A function. And if you have a question for any of our panelists, please use the Q&A function to write that question. If you see a question that you like, or you also have the same question, you can upvote it. So there's a little thumbs up button, and you can click that, and that indicates to our panelists that it's a question a few people have, and so we'll work to make sure that we answer that. That we're going to use the chat function for sharing local resources or any additional comments, but primarily if you could use the Q&A, that's very helpful for us. Just a few things to keep in mind. This is a public forum, so please do not share personal health information here. For questions related to your personal health conditions, it's best to connect with your provider. Please use respectful language free of discrimination, harassment, and bullying. This webinar will be presented in English with closed captionings. You can select that on your webinar function. If in the future you do require additional accessibility accommodations, please indicate that in your registration, and we'll work to ensure we have that available. And we are going to be recording this session, and we will share this out with other resources that come up during this recording in a follow-up email. Okay, great. So without further ado, I'm going to hand this over to Melissa Lem, and she's going to discuss the connection between nature and health.
Thanks so much, Sarah. It is my pleasure to be joining you from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, otherwise known as Vancouver, here on the west coast of the country. And as mentioned today, I'm going to be talking a little bit about climate change and how it affects our health, and then one of the best ways that we can take action on both our health and climate change, which is connecting to nature, possibly through prescribing it. Next slide, please. This is a schematic that was created during one of the Lancet Canada countdowns recently. And as you can see, climate change is already affecting health in Canada. So from impacts on availability of traditional foods and mental health in the north, to wildfire-related asthma and evacuation, to flood-related deaths and damage, increased rates of allergies, especially more in central Canada, tick-borne disease like Lyme disease, heat-related illness, which we really experienced here about a year ago in the lower mainland of BC, and right now, as it's almost 30 degrees in my home right now, as I'm speaking to you, to relocation and stress from coastal erosion and displacement within Canada and from other countries. Climate change is, as the World Health Organization has said, the greatest threat to public health of the 21st century. So climate change, the climate crisis, is a health crisis, and we need to take action on it to make sure that we can continue to live healthy and safe lives now and into the future. Next slide, please. So if you think about what makes Canadians sick, or what makes them healthy, as you can see from this slide, only about 20 to 25% of our healthcare status comes from what we do in our health status comes from what we do in our healthcare system. So what I do in my outpatient office, or in treatment rooms when I work rurally, or in hospitals, this really doesn't make up the bulk of what keeps us healthy or makes us sick. And if you think about different factors like climate change or like nature in our environments, and you look at that middle column of all those different categories or all those different things that make Canadians sick or well, you can start to think about how it's really important that we advocate for healthier environments and more nature in our environments to ensure that we stay well, even when we're outside of our offices. And so that's why I and many people on this call spend a lot of time advocating for these social and ecological determinants of health, is because arguably they'll have more impact on our communities and our patients' health than what we do within our healthcare system. Next slide, please. And as I mentioned, the World Health Organization has said that climate change is the greatest public health threat, but taking action on it is our greatest opportunity to improve health, because not only will it reduce carbon emissions on one hand, but also improve our lives in so many other ways. And next, I'm going to talk about the main topic of this presentation, this webinar today, which is how connecting to nature and prescribing it can improve our health in tangible ways and improve the health of the planet in tangible ways. Next slide, please. So I'm Director of Park Prescriptions for the BC Parks Foundation, and PARX was first launched in BC in November 2020. And since then, it's spread to every single province across the country, most recently ending in Newfoundland and Labrador in June of 2022. And we've just been so pleased and proud of how much has been taken up by healthcare professionals and how much attention it's gotten from governments, from the public, and international people as well, in terms of it being an effective way to improve people's health and the health of the planet. So I'm just going to talk a bit more about the connection between our health and nature. Next slide, please. So I just want people to, you can actually add this to the chat if you like, in one word, either think about or describe how you feel when you are outside in nature. Just take a moment to think about when you're in your favorite green space and how you feel, and you can feel free to put that in the chat. Oops, people are putting, oh, the chat is disabled. Okay, someone put it in the Q&A. Less stressed, I didn't realize that. Anyway, so keep those words in your mind. And I'll just give you an example here of one of the different word clouds that we've done before. Next slide, please. That describes how other people have felt when they spent time in nature. So some of you may have thought the words calm, peaceful, grounded, happy, relaxed, or restored. And this is this real intuitive sense that we have, that we spend time in these green or blue spaces, that we feel better. Next slide, please. But that intuitive sense we have that we feel better when we spend time in nature is backed up by a huge amount of evidence. And this is something that I discovered when I had my own nature and health deficit episode when I moved from working as a full service rural family physician in northern BC to downtown Toronto, where I started working in student health, outpatient student health at the University of Toronto. And even though the work itself was much, much easier, I found myself so much more stressed. And I realized at one point that I felt like it was a lack of nature. And I sat down and I did this lit review because, you know, as an evidence-based health professional, obviously it doesn't exist if there aren't randomized controlled trials. And what I found was that there were a ton. And so as you can see, these are just two infographics that I've been given permission to share. The one on the left-hand side describes lots of different, lots of physical health benefits and mental health benefits, from improved bone density to reduced risk of diabetes, heart disease, and high blood pressure, to improve depression and anxiety, to reduce symptoms of ADHD in kids, reduce pain and pain medication use after operations in hospitals, and improved work satisfaction. So as you can see, spending time in nature, the research shows that it is one of the best things that we can do for our health. Next slide, please. So now I just want to share some of my favorite studies that have to do with the health benefits of nature. And this one very wonderfully actually happened right in Toronto. And so this study combined high resolution satellite imagery, individual tree data, and Ontario health study data, and self-reports of health perception. And then after controlling for a number of confounders, some of the major findings that they discovered were that 10 more trees per block improved people's health perception, similar to an increase in their personal income of $10,000 per year, moving to a neighborhood with $10,000 per year higher median income, or being 7 years younger. So we know both in healthcare and outside of it that both income and age are major factors when it comes to our health. So I thought it was really interesting how this study compared two things that we know influence our health in major ways to a very objective measure of nature in people's environments, which is tree cover. Next slide, please. I like this study because it speaks to how nature can be viewed as medication in kind of a very discrete way. And this was a study that looked at 17 kids with ADHD, and they guided them on 3 different 20-minute walks through a city park, through a downtown area, and through a residential area. And what they found was that a 20-minute walk in the park actually improved people's digit span backwards performance, similar to levels in kids without ADHD. So some interesting things about this study is it separated out the effect of exercise. That's something people often ask as well. Is it just that you're moving and so that's making you feel better? The kids took the same 20-minute walk in all these 3 different areas. And then something else interesting is you can see that, again, that park walk significantly improved this DSB score, which is sorry, I'm just seeing stuff popping up in the chat, which is distracting me a little bit. Anyway, basically it's a simple test where you recite a sequence of numbers in a row, and then you ask the participant to recite them backwards to you in the same, in opposite order. And the more numbers you can recite, the better your memory and attention. And again, you can see that left-hand line on this graph that you can see, it's significantly higher in terms of that DSB score than in the park walk than the neighborhood and downtown walk. And when they crunched those numbers, they found that this rivaled the peak effects of prescription stimulant medication like Ritalin. So no one is saying that a 20-minute walk in the park is going to replace everything that prescription stimulant medication does. But I think this really speaks to how powerful nature time can be as an adjunct to what we traditionally prescribe in the office. Next slide, please. As a physician, as a healthcare professional, when I think about prescribing something, anything like a medication and nature, you think, okay, what's the dose? Like, how much should I be prescribing at once? And how often should this person be filling this nature or other prescription? And luckily for us, information about dosing has come to the fore in the last few years, just as we were launching this nature prescription initiative. So this study comes from close to 20,000 adults in England. And what they found is that their likelihood of reporting good health or high well-being was significantly greater when their nature contact was greater than or equal to 2 hours or 120 minutes per week. And those positive associations continue to accrue and to about the 200 to 300 minute per week mark, and then just leveled out. So that's why in our program, we say to maximize your health benefits to spend at least 2 hours in nature each week. And it's backed up by the latest research. Next slide, please. This next study speaks to how much each nature pill should be, like how much time should we spend in nature each time? And this is an interesting question because there is research showing that even just 5 minutes of sitting outside can improve some mental health markers. But we want to see, you know, we live in cities often, we're really busy people. We want to know what's the biggest bang for your buck in terms of the range of time we'd spend time in nature. So this study also came out in 2019, just like the last one, as we were formulating our recommendations. And it looked at 36 urban dwellers over 2 months. And they asked them to have a nature experience in an outdoor place that brought them a sense of contact with nature at least 3 times per week and for 10 minutes or more. And what I want to emphasize here is that it was self-defined. They didn't say you have to go to this particular area that has a certain amount of biodiversity, far away from cars or buildings or other people. They said you self-define it and spend at least 10 minutes or more 3 times a week. And what they found was after that 20-minute to 30-minute nature pill, that cortisol or stress levels dropped almost 20% more after a nature experience compared to a non-nature experience. And that efficiency, so if you see that third kind of discontinuous red line there, the magnitude or the rate of the drop was greatest between 20 to 30 minutes. So if you want to get that biggest drop in stress, aim for at least 20 minutes when you're spending time in nature. Of course, if you want to spend more time and you're enjoying yourself outside, don't cut it off. But for us busy people who live in cities, just remember that 20-minute mark. Next slide, please. So I'm also, as Sara mentioned, president-elect of the Canadian Association of Physicians for the Environment, and a major reason why I spend so much time on this work is because connecting people to nature is good for the planet too. So we know that healthcare is a major contributor to global carbon pollution. If global healthcare were a country, it would be the 5th highest emitter in the world. So anything that makes people healthier is going to reduce demand on the healthcare system and reduce overall carbon pollution. We also know that having more nature and green space in our cities makes cities themselves healthier, makes the infrastructure healthier, which I'll get into in the next slide. We also know research tells us that kids who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. And the amazing thing is this goes beyond just conservation for nature support, because it makes sense that you want to protect what you love. But people who are more connected to nature tend to save more energy. They tend to recycle more. They tend to vote more for climate advocates and engage in more other forms of climate action. So I like to think that every time a regulated health professional in our program prescribes nature, that we're doing a little bit for the planet at the same time. And finally, Inger Andersen, the executive director of the UN Environment Program, has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So if we were to fully embrace nature-based solutions for climate change, which focus on restoring and expanding nature while at the same time dealing with human and societal issues, that this could get us over a third of the way towards our 2030 Paris Agreement targets. And right now, globally, only around 5% of total climate investments are made in these nature-based solutions for climate change. And if you think of the gap in potential versus the actual funding, if trusted healthcare professionals and patients and communities start to demand more nature and more nature-based solutions in their communities and on a wider scale, I think this has a lot of potential to close that gap. Next slide, please. So just a little bit more about the benefits to infrastructure of nature in cities. So urban greening, more tree cover, more green spaces, increases the amount of shade available and reduces the need for air conditioning and energy use. This is especially important in places where the energy grid is not renewable and is powered by, for example, coal or natural gas. Lower energy demand also reduces air pollution and greenhouse gas emissions. Trees and green space remove air pollutants, and they also sequester carbon dioxide. They reduce flooding. And it's estimated that every $1 invested in an urban tree returns up to $3 in benefits. So it's a good bet economically as well. And on the west coast of BC, again, here in the Lower Mainland, just about a year ago, we had the heat dome, the famous BC heat dome, which is the deadliest natural disaster, deadliest extreme weather event in Canada's history, and it killed over 600 people in the space of just a couple weeks. And so one of the independent factors that was determined in terms of mortality was, in fact, the amount of green space close to where people lived, just similarly important to age and chronic disease and income, and also access to indoor cooling at having an impact on mortality. So access to nature is an equity issue as well. It's not just a nice to have, it's a must have when it comes to dealing with the effects of climate change we're already seeing and will see in the future. Next slide, please. We were really, really proud that our PARC prescription program, which I'll talk a bit more about later, was recognized by the World Health Organization in their COP26 special report for climate change and health as one of only 2 case studies from North America. And they highlighted it as an effective way to inspire protection and restoration of nature as the foundation of our health. And it was really the first time, I think, that this initiative was recognized internationally, and it's only grown since then. Next slide, please. If you're interested in learning more about our program, we have 2 websites. One is the English website, which we first launched at parcprescriptions.ca. The second one is a francophone website at prescrit-nature.ca. So if you're interested in evidence-based resources and a really kind of clean and patient and prescriber-friendly resource on the health benefits of nature, please feel free to check it out. Next slide, please. And if you're a regulated health professional, so this is not just physicians, it also includes, for example, nurses, psychologists, occupational therapists, registered clinical counselors, you can register to prescribe nature through our program. And I'm really proud to say that I think we have about 9,000 registered regulated health professionals across the country registered to prescribe nature in our program. And this includes just over 5% of all practicing physicians in the country. So for a program that's only been around for about 1.5 years now, I think that's pretty incredible. So you'll receive a customized nature prescription file with a unique provider code, and also instructions and a toolkit on how to prescribe nature effectively. And then we also have 14 different fact sheets on our website that break down the health benefits of nature by adult and pediatric ages, and also different health conditions. So you can check that out if you're interested, if you want to learn more about the specific health benefits of nature for certain health conditions. Next slide, please. And then something that really grabbed a lot of national and international attention as well was when we announced our collaboration with Parks Canada at the end of January this year, where we announced that prescribers in our program can now prescribe one free Parks Canada Discovery Pass per month to patients who preferably live close to Parks Canada administered sites, and also for whom the cost of a pass would be a significant barrier to access. And this is part of our whole drive to reduce barriers to nature access. So not only are we allowed, or can we prescribe Parks Canada Discovery Passes, but we're forging partnerships with nature-based organizations and experience providers to also provide free admission or discounted admission or to different nature-based experiences across the country. We've also been speaking with different transit and transportation organizations because transportation is often identified as a barrier to nature access, to see how, again, we can connect patients to nature more easily. Next slide, please. So finally, in terms of calls to action, if you're inspired after listening to this, this part of the talk, spend at least 2 hours in nature each week and at least 20 minutes each time to optimize your own health and resilience. Spread the word to your health professional or your doctor about park prescriptions. If you know a nature-based organization or venue, please feel free to connect us because we're trying to expand our suite of benefits available to patients. And also donating to charities is an important way to support our work. So the BC Parks Foundation or CAPE. And the last thing I want to do, because this is really what drives my work, is hearing stories from patients and from other providers' patients about how our program and how connecting to nature has improved their lives. So I just want to share a video that was created by CNN behind how nature improved one patient's life and a bit more about the evidence behind the health benefits of nature.
About a year ago now, I was in talking to my doctor and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh goody, one more pill. And he says, no. I want you to spend 2 hours during the week outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, you know she's 75. So I'm going to tell you that I'm 91. So that's why she takes care of me.
I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. Park Prescription, or PARX, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with Parks Canada where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees, so we're hoping that by prescribing these Parks Canada discovery passes that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains, and the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically, when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, you're absolutely right. When I spend more time in nature, I feel better. And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says this is a good thing to do, this is worth the effort to do. You need to get out of doors and just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life.
Thanks so much for listening, everyone.
We're just gonna go.
Downtime cost.
We're just gonna switch our screens back to sharing. Thank you so much, Melissa. That was amazing. I am ready to spend my 20 minutes in nature after this webinar, for sure. There's a few comments in the chat that's you know, and then I think we're going to highlight. You know, Melissa highlighted some really great. The Parks RX, which I think our department is really looking to get involved in. So this is a really great primer for our patients to understand for when you might get a Parks RX or a prescription for nature with your family physician. And we're going to talk about local resources and how to get out in nature, even locally in the city, because there are quite a number of great opportunities. And so we'll highlight some of that a little bit later, and anything that we can't highlight, we'll try to loop back to in a discussion. So thank you so much. You know, Melissa also highlighted, you know, the importance of getting out in nature specifically for young kids, and how that translates into adulthood and childhood development, which leads us really well into our next speaker. So maybe we can progress the slide and to the next slide. And yeah, I'll hand this over to Trina, who's going to just highlight the importance of nature in early childhood development. Over to you.
Thank you. Okay, can jump to the next slide. Okay, so as we just heard, we're going to continue this topic of spending time in nature and see how is this able to support healthy development in young children. Next slide. So children are constantly learning and growing. If you have young children in your life, you will probably notice that they don't stay exactly as they are for very long. They are really constantly changing. And this idea of children's development that happens throughout their life, they tend to learn new things, they are maturing, and it often follows a somewhat predictable, not always the same, but somewhat predictable pattern. For example, babies tend to babble before they use a word. They tend to use a word before they speak in sentences. So we can kind of have this understanding of the progression of development. And their development covers many different areas. Things like physical development, how they're moving their bodies, their cognitive skills, how they're thinking and using their mind, communication skills, how they express themselves, and we'll come back to these skills. Their development also includes development in the area of social and emotional skills. And social and emotional well-being is otherwise known as mental health. So you can see that there is development across all areas, physical and emotional, all of the different areas, and to take a peek at how spending time in nature might give many opportunities to support that development. So next slide, please. So, you know, I think most people who have children in their lives, we want those children to thrive and flourish. And the question is, how can we support them? So there's a document that a lot of early childhood educators in Ontario use. It's called How Does Learning Happen? And that document, they talk a lot about how can we set children up for success and have their most optimal learning environment. And there are sort of 4 foundations. So I think there's some educators in the crowd. I saw in the chat a few people chiming in. So you may have used this or a similar document. These 4 areas include having a sense of belonging, engagement, the ability to express yourself, and also having well-being. And so when these 4 foundations are enriched, it really sets a good stage for supporting children to have the really best learning and best growth that they can. And spending time in nature is one way to offer many opportunities to strengthen those foundations, and it can be done every day. Next slide, please. So a sense of belonging, when a child is going to feel that, they might be feeling something like, from their perspective, it might sound like, I feel a sense of connectedness, or I feel valued for who I am. And I know what it's like to form relationships with others and form relationships with the natural world. So, you know, for, let's say, a family or group of people that's spending time together outdoors, like this picture on the left, there's a sense of connectedness. Maybe in other situations, there are a lot of distractions, maybe devices, maybe cars. You know, there's always something to do. Sometimes when you're in a natural environment and you're with people that are important to you in your life, you get that sense of connectedness. If you look at the picture on the right, there is an adult and a child kind of working together in a garden. There's a sense when you work together on a project, a sense of contributing to, it could be to your community, could be to the natural world, but that sense of working together and joining in on something really brings that sense of belonging as well. So many opportunities when you're in natural environments to enhance that sense of belonging, and then ultimately also enhance overall learning and development. Next slide, please. Another foundation is engagement. This is another foundation of creating optimal learning environments for children. So children tend to have a natural curiosity. So again, from a kid's perspective, this might sound like saying, I have a natural curiosity, and it signals me to actively explore my world using all of my senses. This inquiry over time is going to build my capacity to problem solve, think creatively. And the thing about nature is that there are many things that can catch a child's interest and spark that curiosity. So the picture on the left, there's a little insect. 2 children are taking a look. I don't think anyone's forcing them. It really looks like they're just genuinely interested in it, using senses of touch, using their fingers to explore, of sight, they're leaning in. So really like having opportunities to spark that curiosity. Then on the picture on the right, you can see a kid exploring a puddle. If you have children and you've had them out in wet environments, you might notice they are sometimes drawn to the messiest thing that is out there. Sometimes it's a mud puddle. And so there's a lot of exploration. You can feel the squishy mud underneath the boot splashes on their skin of the water. So this is not just a bit of a messy scenario. It's a really amazing scenario for learning and for developing a deep engagement with what's going on in the world around us. Next slide, please. So another foundation is this idea of expression or self-expression. So from a child's perspective, this might sound like letting you know, I am a capable communicator and I express myself in many ways, including with my body, with my words, and with other materials. So when it comes to children expressing themselves, I think a great question you can always ask, no matter how young they are, is what are they telling me right now? And the thing about nature and being in a natural environment is that there are a lot of things to provoke communication about. There's a lot of interesting things out there. So this baby on the left, I don't know exactly what they're thinking, but I get the sense that they're kind of letting me know I'm interested in something. Their head is up, their eyes are looking off. They seem pretty engaged, so that, you know, they're telling us something. I'm interested in this. I want to see it. I want to see more. And then this picture on the right, I'm not exactly sure what is going on in this little person's mind, but they really seem as if they are communicating something. There's something going on for them. Their toes are in the sand. Eyes are closed, and they're really just something's going on inside. They might be telling a story about something that they saw describing. They might be using their imagination to tell something. They might be singing a song. Who knows? But in those natural environments, there are no shortage of things to catch one's attention, to spark one's interest, and to communicate and express about. So yeah, next slide. Thank you. That was good timing. You read my mind. So this last general foundation that I want to talk about is the idea of well-being. And please excuse the picture on the right because it has a disposable single-use plastic water bottle. So we can imagine that that is a reusable one. So when it comes to well-being, we're thinking about both physical and mental well-being. So from the child's perspective, this could sound like my mental health or my mental and physical wellness matter. Being in nature gives me many chances to strengthen my sense of self and to practice the important skill of self-care. So if you take a look at the picture on the left, I just imagine that, you know, this little one has built this snowman. You can just imagine them saying like, look what I did. If you have any young kids in your life, you know that moment when they're like, look, do you see, are you watching? Like, look what I did. I think part of that is really about their sense of self, that strong sense of self, and they want you to see what they see about themselves. So I can imagine this kid saying, look what I built. I worked so hard to create this and I'm proud of myself and I want you to see it too. So it's really strengthening that sense of self, contributing to well-being. Another part of that is self-help skills or taking care of one's needs. So for this little person, you know, playing outside makes me thirsty and learning to take care of myself and give my body what it needs. In this case, you know, get in touch that I feel thirsty and I need to give myself a drink of water. So being in nature really provides a lot of opportunities. It provokes a lot of signals to, yeah, really just so many opportunities to keep enriching. So next slide, please. So a lot of educational philosophy is influenced by the idea that the environment is a teacher. So one teacher is the family, the caregivers. Another teacher is, you know, the more formal teacher or educator at school. But the environment, in other words, wherever you happen to be, whatever environment you are in, is a teacher. When you're in a classroom environment, the way that classroom is set up is teaching you something. I think we've all learned this a little bit too in the age of the pandemic with the a lot of signals on the floor. If you're at the grocery store and there's an X here and an X here, we kind of know, oh, we're supposed to stand a little bit apart. So that's the environment teaching us something, right? So it kind of raises this interesting question of if the environment, whatever environment it is a teacher, what can children learn when they spend time in natural environments? Next slide, please. So this comes back to the skills that I mentioned at the beginning. And these are the same skills and areas of development that you probably will have assessed when you're at the doctor doing checkups and well visits along the way. So these may sound familiar to you. So the first area is physical skills. So this has to do with how children use their bodies, could be the large muscles or even the small muscles in their hands. So in that first picture on the left, there's a baby crawling and there's a skill that's about sensory motor development. So this is like how I incorporate my senses with my body movements. So you can imagine that this baby saw that leaf and that used that sense of sight, saw that leaf and wanted to go for it, and then coordinated his body to match with that sensory input. So now we're crawling, we're motivated to get to that. And we haven't seen it yet, but I can imagine like a nice little pincer grasp that comes after when they pick up that leaf. So lots of opportunities there. The second and third pictures have children climbing, jumping, running. If you have young ones, you probably have experienced this. And when you're at home, sometimes it's a challenge, right? They want to climb on the furniture, they want to jump off the bed. It's not always possible. You might be worried about them bumping themselves on a sharp coffee table, or, you know, the downstairs neighbors are always complaining that my kid is jumping around too much. There's no downstairs neighbors complaining when you jump in the park, although I haven't asked the squirrels, so I could check with that. But so there's a lot of freedom to explore and move around, and you don't feel that need to kind of restrict their natural movements. And it really just gives them so many opportunities to support those gross motor and fine motor skills. Lots of space and lots of natural things to play on and climb with. Next slide, please. Another area of development that gets lots of practice when you're in natural environments are cognitive skills. Have to do with things, thinking things through, solving problems, exploring and learning through exploring. So in that first picture, there's two kids that had built a snowman together. The idea of having an idea and then translating it into something physical. It's a skill of representation. So they've decided to make that snowman, and then they represented it using snow. So that's an amazing physical cognitive skill. In the second picture, there's a child, I think maybe they're like counting leaves, like, oh, there's so many leaves, I wonder how many they are. And now we're counting leaves, right? Another cognitive skill. Then the last picture, there's a little kid digging in the sand. Kids are always exploring their spatial skills. Object permanence is one that comes up when young children are developing the idea that something still exists, even when you can't see it, even when it's buried under sand, it might still be there, or dirt or earth. So exploring in that way can really strengthen those skills. So many opportunities. Can you develop cognitive skills outside of nature? For sure. But there's also so many great opportunities when you're in a natural environment for these things to come up in a way that's organic and child-led. Next slide, please. So next we have communication skills. This is how children express themselves. And it can involve nonverbal communication, speech, and literacy. So in that middle picture, there is like a caregiver and a baby both looking at these flowers. And what's interesting is they have a shared attention. They're both looking at the same thing at the same time. And having a shared attention is a really great promoter of communication skills. So when we're both looking and both focused on the same thing, we can communicate about the same thing. Sometimes you have, a child looking in this direction and a parent looking in the other direction saying, look at this. We're not really communicating about the same thing because we're not sharing our attention. On the left, there's a little kid who's found something interesting that they want to bring the caregiver's attention to. And then on the far right, there's a kid using a stick to do some writing. And I'm not sure if he's spelling everything properly, but there's an engagement with literacy and the conventions around print and literacy. So even just doing squiggles, in the sand and saying, look what I wrote, is engaging with literacy. So some more great opportunities here where being in nature has really provided a great opportunity for supporting skills. Next slide. So next is social skills. So this is how children are acting, interacting, and engaging with others. And being outdoors offers a lot of great opportunities. So in that first picture, you see two kids climbing on a log. And the second one looks like they're ready to climb up. The first one is still hanging out. So this brings up a very interesting moment to practice social problem solving. What do I do when another kid's on the slide and I really want to go down it and they're not finished, right? So here's a great opportunity. Natural environment, there's only one log that's lying like that. And so we have to do a little negotiation, which is a great social skill. In the second picture, there's one kid helping another kid, pushing them along on the car. So you've got some cooperation, some teamwork, maybe even some empathy, because, you know, maybe if I were on that car, I would really want somebody to help me, so I'll help them. And then the last picture is of like a young little one. If we can just go back one more, thanks. The last picture here on the right of the social skills slide is an example of sort of a one-to-one interaction or a turn taking back and forth. So this could be like playing with leaves, and we throw them up in the air, and the adult does it, and the baby does it, and the adult does it, and the baby does it. And this back and forth turn taking is actually the basis for future language and communication skills, because that's what we do when we talk, right? Someone else says something, then I say something, and someone else says something, then I say something. So with all of those leaves, great opportunity to practice the fundamentals of future conversations. Next slide. I think this is the last skill set that we're going to talk about, which is emotional skills. So children are always developing, and this includes their emotional skill development. So in that first picture, I kind of imagined that kid was climbing the tree and kind of looking down, like had a moment of, I'm feeling a little nervous about this. I really want to climb the tree, but also I'm looking down, I'm a little nervous, right? And there's a chance to have that experience, both of those experiences, right? Of feeling excited to climb a tree and motivated to do that, and also a little nervous about it. And that's developing those emotional skills by having opportunities to express them and feel them. The full range, right? The full range of emotions. The kid in the middle is doing some balancing on a log and really focused and determined look on their face, like, I'm going to do this. And then probably quite a sense of pride afterward, after walking across that whole log, and some trust happening between them and the caregiver. And then the last picture on the right looks really excited to me. And seeing this idea of emotional regulation, which is a really commonly talked about skill. So it's the idea of, you know, raising your emotions raising emotions or lowering intensities of emotions as the situation requires, having that full expression as well. So this kid looks very excited and really getting a chance to have that full excitement and experiencing that. And then maybe in a few minutes, it might be time to get ready to go inside. They may need to and have a chance to practice lowering the intensity of that emotion, maybe raking those leaves back up and then heading inside, maybe for dinner. So there's a lot of opportunities to practice emotional skills here. Next slide. So a really important piece to young children's development and also their social, emotional well-being and mental health is the relationship they have with their trusted caregivers. So having a responsive relationship and a trusting bond with their caregivers supports children's mental health now and throughout their lives. So spending time in nature provides a lot of opportunities to support children's development, and it is important. And even more important is spending time in nature with you, so that that bond and that responsive relationship is built over time. Next slide. So lastly, just wanted to give a couple ideas of how can I spend more time in nature. And I know in a couple of points, questions that came up in the chat so far have been around finances and like, how can I, you know, do these things in a way if I, you know, how can this be accessible to me, even if I can't, you know, take the train all the way to BC and see those beautiful forests. And also some questions about weather, because we live in Canada and a lot of the year the weather is pretty cold. So here's a couple of ideas if you are interested in spending more time in nature with your family and possibly with young children, you could try connecting with a local early on program. So especially in the summer, they do a ton of field trips, group field trips. So you can go with your family, with your children, and you have a bit of structure and guidance when you're doing these excursions. So you might be going to a new place for the first time, or you're not sure how to make this work with kids. And then you have the support of early childhood professionals to help you see, ways that you can make it work and have that guidance and company. You could also try an urban scavenger hunt. So this would be wherever you live. You could try doing a scavenger hunt around your neighborhood. So for example, we're going to go on a walk, and can you find a tree that has needles? Can you find a squirrel, a bird, a cloud, an ant, a purple flower? So in this way, you're kind of engaging with the nature that exists wherever you are, because I have yet to find a place in Toronto that doesn't have a squirrel. So there's a chance to connect with nature, even if you're not having the ability right now to go far from where you live. You can explore places that are local to you. So this could be things like Riverdale Park, Allen Gardens, Corktown Common, Woodbine Beach, Evergreen, Brickworks. We'll give more examples later. These places are accessible by the TTC. Another suggestion is maybe start with a shorter trip. And then once it becomes a little bit more familiar, predictable, and everyone's more comfortable, then you can try a longer visit. You also might want to think about what might work for your family in particular. So if you have young children, they nap at 10 o'clock, starting a 4-hour trip at 9 a.m. might set you up for having some cranky children, because it's going to go through their nap time. So just thinking about things like that. If you need to have a stroller, are we going somewhere that, is convenient for a stroller, that kind of thing. And then a last idea is maybe bringing some nature to you. So you could try sprouting seeds or container gardening in your home. You could try playing a game of I Spy. This could be from your balcony, from a window, from a porch. So you could, perhaps I spy something that is green. And can you guess what it is? And we can engage with all the green things that we can see. So that is it, I think, for me. Thank you so much. Hopefully everyone gets a chance to spend some time with their families out in nature.
Thank you so much, Trina. That was so informative, and you really brought those pictures of those children to life with your descriptions, and I really felt that they were learning those developmental skills and, highlighting that the more time they spend in nature, just like Melissa said, the more social advocates they'll become, and the more they appreciate nature and will help to preserve it ongoing. So thank you so much for all of that information, and also highlighting, that these nature is all around us. And, while it would be amazing to get out to BC and to see those beautiful mountains, or to get up north in Ontario, we don't need to go far to still have the health and mental benefits of nature. And so I guess that leads us into our next speaker, Dr. Samantha Green, who's going to highlight some, local City of Toronto resources and programs that you and your family can take part in to get out in nature. So over to you, Sam.
Great, thanks, Sarah. And I'm by no means an expert in this particular topic, so please feel free to chime in the chat if you have other ideas or suggestions. Yeah, you can advance the slide. So we talked about green spaces already and their importance, and I'll just highlight that what Melissa, Dr. Lem already mentioned about the benefits of having an increase in green space in urban areas, really decreasing air temperature during extreme heat events and heat waves by up to 15 degrees. But not only that, but having an increase in green space in urban centers can also act as social spaces where people can build community. They can keep the air clean, and they can absorb stormwater runoff. So limiting the impact of heavy rainstorms that can cause flooding, supporting biodiversity, and also access to green space is particularly beneficial for people living on low income, racialized groups, and children, which you just heard. Okay, next slide. So I don't know if you've heard this nickname for Toronto, but it's on some of the signage around the city. If you see any park or parquet around, the name of the park or parquet, just underneath it, it says the city within a park. And I just love this map of Toronto, which is only showing the green space, but you can see the city actually right there. So next slide. And this is a map of our local area around the St. Michael's Family Health Team. Our clinic sites are highlighted with the stars, and the red circles are a 1 kilometer radius from our clinics. So approximately a 15-minute walk from each of our clinics. And you can see the tree canopy in green. So a number of green spaces are highlighted, including Riverdale Park West, the Rosedale Ravine Lands, Allen Gardens, and Regent Park and Moss Park. Next slide. Oh, and Corktown, sorry, go back one. Corktown Common, which is actually a newer park that opened up about 10 years ago now, and has a very beautiful natural center of the park with a lot of local native plants. So a lot of great biodiversity there. Okay, next slide. So this is a resource from the City of Toronto website, and we'll send out a link when we send out the recording from this webinar. But you can also just Google City of Toronto walking, and there are resources for different trails that you can use, walking information, cycling information, and then information on accessing trails as well. Next slide. And this is just additionally from that website. So all kinds of information I didn't know about. So there's self-guided tours that you can take. There are urban tours, discovery tours, architectural tours. Next slide. And then also additional information about the ravines and parklands in the city. So detailed information about how to access trails, and in particular TTC information. And then there's additional information about what the city is doing to enhance the ravines and enhance nature and biodiversity. Next slide. And I'll just highlight a couple of spaces. So the Don Valley Brickworks is quite close, about a 20-minute walk from St. Jamestown. And there are actually guided tours on Saturdays. There's also self-guided tours that you can take. And Crew, which is an organization that we partnered with for our first webinar, and which I'll provide more information with in a few slides, is also guiding tours from taking people from St. Jamestown into the Don Valley Brickworks on weekends. So Crew stands for Community Resilience to Extreme Weather, and we'll also send out a link to their website. Next slide. And this is just highlighting another resource from that City of Toronto webpage. And this particular image is showing the waterfront trail. And there's just really detailed information on TTC accessibility. And these are ways to stay connected on social media to local City of Toronto programs. I just started following TO Trees on Twitter, but there's also this great Facebook group, Nature in the City, and a couple of other resources there. And finally, I don't know how many of you are aware of this new project. So in the next 5 years, we are getting a brand new park, enormous park, down at the waterfront. So this is the old Portlands area. So just south of St. Lawrence Market area and the Distillery District. It will be a natural area bigger than High Park, right at our doorstep here. And they're building it with the intention of rerouting the Don, because the Don River, so they're basically renaturalizing the output of the Don River to actually protect us from flooding. So this is an intervention that is both helping us adapt in the city to increased risk of flooding from climate change and also increasing our access to nature. So look out for that in 5 years. I know there was some chat about needing more leadership to build more parks, but we are actually about to get a brand new enormous park right in our on our doorsteps. Next slide. This is just more information about CREW, so you can go to their website to find out different interventions that they are engaged in, one of which is a pollinator garden in St. Jamestown that you can participate in and volunteer in. And then I already mentioned the guided nature walks in Brickworks. And then these are some additional resources and community groups that are relevant. I'll just highlight Parks People, which is a nonprofit that advocates for increased access, including accessibility in parks in the city of Toronto. So they have a great website on actually getting out into parks and accessibility in parks. And then there's a number of other resources here that we'll send out links to. All right, and now we have time for discussion, I think.
Thank you so much, Dr. Green. So yeah, we've moved into our discussion part of the webinar. We only have a few minutes left, and I think we've answered a lot of questions that have come up already. Just, highlighting that we do recognize that getting out in nature isn't always easy for everyone, especially those who are seniors or may experience disabilities. So we do want to highlight that there are some local services that do support, particularly getting out with seniors. CREW has really great supports, and they're locally situated in St. Jamestown. So we will link that resource for you all. I just want to take this opportunity to thank our panelists for the great information and discussion. And maybe, Anne, if we could progress to the next slide, we could take this opportunity to, highlight that we will be back. And so our next session will be on the health benefits of plant-rich diets, and we're going to be coming to September 27th to talk more about that. But we will send out information about this next webinar, and we will send out the recording and link those resources to try to ensure that everyone can have access. So I just want to take this last moment, Dr. Melissa Lem, Dr. Samantha Green, and Trina Rosenwig, thank you so much for taking time out of your day to present this great information. And we wish all of you a great rest of the evening, and maybe you can take the next 20 minutes to get outside and enjoy that nature and reduce your stress levels. So I think we'll end this webinar here, and thank you so much, everyone.